Good afternoon. And thank you to the Social Innovation Summit for once again bringing together such a wonderful crowd. It's such an honor to be here today. I invite you all to take a moment and think about how you got here. Maybe it was an easy or hard commute. I walked across the street from my hotel, so I was lucky today. But for 14 million Americans, there's no reliable transportation option in daily life. My name's Amanda Lenaghan, and I lead social impact at Cruise. We're an all-electric driverless car company. So we're working on this issue of how do we build a safer, more accessible, and sustainable transportation future. And I couldn't be more delighted to be joined by these three visionary women. They are absolutely charting the path forward in inclusive and equitable mobility. So today we'll get into discussion around how do we address these disparities that exist, and how do we do so in a way that puts the community at the center of the design process. So let's get started. I'd love to have us kick off with introductions, share with us a little bit about yourselves, and if you can comment on what designing with communities means to you. It'd be great to start with you, Dr. Shelley.
Absolutely. Good afternoon. So glad to be here with everyone. How many people actually already drive an electric vehicle? Okay, got a few, less than 10. How many people have been in an autonomous vehicle? More than driving EVs. Okay, perfect. So as Amanda said, Dr. Shelley Francis, I'm one of the co-founders and managing partners at Noire. We're a consultancy that works on electric, connected, shared, and autonomous mobility. I'm also the co-founder of a national nonprofit called EV Hybrid Noire, and their mission is to equitably accelerate clean transportation, but in a way that is inclusive and encompasses, communities' needs. So when I hear about designing with communities, one of the things that I think is critically important is that it means really engaging deeply with those communities that are facing mobility disparities and ensuring that their lived voices, their authentic experiences are part of that narrative. So that's what I really think about is meaningful when I hear about developing strategies with communities.
Good afternoon. My name is Valerie Lefler. I'm the executive director and founder of a nonprofit called Feonix Mobility Rising. And our mission is to create mobility solutions for the health and well-being of every person in every community. We currently operate in 5 states and really look at mobility as a key component of health equity and addressing social determinants of health. And when we think about co-creating solutions, one of the components of the Transportation Assistance Hub, which is kind of the model that we deploy our program, is that we have what's called a mobility leadership circle. And this mobility leadership circle comes together on a regular basis with experts from all social determinants of health, ranging from major employers to government to city, as well as individuals in the community with that lived experience. And they have shared power in the decision-making and the authority of how that transportation assistance hub works in the community. And so in some cases, when we put together our transportation assistance hub in a community, those leaders really want to address transportation barriers. It's an economic mobility and literal mobility solution that they want to prioritize. In other cases, it's health equity, and they really want to tackle infant mortality and how do we help make sure our mothers can get to where they need to go. And some, it's all of the above. But it's the community that decides the how, the when, and the where, and we just bring the connective tissue to address those barriers.
Awesome. Well, super glad to be on stage. Hello, everyone. My name is Michele Lee. I use she, her pronouns. And I'm so glad that we're here in my hometown of Chicago. I'm based here, and I serve on the Chicago Transit Authority Board, and so we kind of run the transit system here. When was the last time anyone was on a bus? Because this was this morning for me. So hey, talk about how to get around. But for me, transportation is really important for me personally. I became a disabled person a little over 20 years ago when I crashed my car, lost the ability to drive, lost the use of my legs and walking, etc. But very much found it's not easy to get around as a person with a disability. And if you don't drive anymore, if you don't live near a public transit hub, there's just not a lot of options, right? And transportation insecurity is a thing. We talk a lot about food insecurity, but transportation insecurity is something that is very real to a lot of people. 1 in 4 people in America is from the disability community now. That's a lot of people, and we're all getting older, right? We're all aging into disability. If we can live a long life, we'll probably experience disability at some point. And at the Chicago Transit Authority, we recognize that transportation is a right, and like if you cannot get to work, you cannot get to the healthcare, you cannot get to the grocery store, you're not getting anywhere. And being on the board, serving here, it's been an honor, but also really highlights the need of transit and transportation. And it's like, if we're very lucky here in Chicago, and not everybody has such a great transit system. So happy to be here and happy to be part of this discussion.
Well, we're lucky to have all of you on this panel, and you can see why. I'd love to stay with you for a moment, Michele. If you can help us understand what these key barriers are to inclusive and equitable mobility.
Sure.
You've commented on it. Are you seeing any promising solutions that you feel we should shine a light on, and that we should begin replicating?
Sure, yeah. I mean, I love the idea of just working with people who are using the systems and working much closely with them. So understanding their needs, understanding, I represent one small part of the disability community, right? I'm a person who uses a wheelchair, and the disability community is not a monolith. There's lots and lots of different folks, and it's a beautiful community, but we all have different needs, and making sure that we're designing our systems so everyone can use them is really important. And so really highlighting and centering the voices of the user is something that I'm passionate about. And I mean, aside from just riding the transit system every day like myself, but like just getting to know other folks who use it and making sure that we're being equitable, because transportation is a right.
Well said. Shelley, what are you seeing from the communities you're working with in terms of the key barriers they're facing?
So we hear a number of different areas that are identified. So one is just awareness and lack of information about inclusive mobility. And the second piece is infrastructure. And then I would say limited workforce and economic development opportunities. And I won't touch on the infrastructure because there's a lot of information that's accessible right now about the infrastructure investment by the federal government as well as the private sector. But I will say two things that I'm seeing promise in terms of things that we actually employ is that doing that critical data research is really critical when you're engaging with new stakeholders, with communities. You need to understand, like I mentioned initially, holistically what's happening, what's their historical context, what are their knowledge and attitudes, beliefs, or barriers and opportunities to utilizing mobility options, right? And so once you do that, then you can actually deploy tailored strategies that are going to be really more effective and meet the needs of communities. So whether it's marketing messages, whether it's pilots or programs or policy, it's really important to do that formative work. A good example of that is that we did a study with Union of Concerned Scientists, Consumer Reports, Green Latinos a couple years ago looking at readiness to adopt EVs. And what we found is that Black and Hispanic communities or stakeholders that were part of this study were more poised and more interested in adopting EVs compared to their white counterparts. Now, when you look at the narrative in terms of marketing vehicles, that's a very different conversation. It's a very different narrative than what we saw in the data. And so that's one of the reasons why it's really important to do that critical data and research, because now you can tailor your marketing strategy based on knowing what your audience is needing. And then my last point is around workforce and economic development opportunities. Because there's such a huge investment in EVs and AV technology, depending on the study that you're seeing anywhere between 500,000 to 2 million jobs being created by this industry by 2030. There's not enough people to fill those seats. Earlier today, our colleagues were talking about just not having enough candidates, particularly diverse candidates, to fill slots. So seeing that need, our organization created an e-mobility fellowship program that creates a career pipeline for young people to enter the e-mobility sector. And so what that means is that the young people are going through this 9-month curriculum program that exposes them to all facets of e-mobility. So whether they're at a trade and technical school or a community college, a tribal and indigenous school, HBCU, or Hispanic serving institution, there's an opportunity to really diversify the workforce and really bring in folks into the space who are underrepresented and are more likely to be disproportionately impacted by transportation emissions.
That's powerful. And I can share firsthand what I've seen in terms of your research approach and the focus groups that your team has led to really surface these insights. So it's incredible work that you're leading. And Valerie, I'm curious if we shift to trying to bring this down to an individual level. What are you seeing in terms of barriers community members are facing in your communities, and can you make this palpable and real for us in terms of an actual story of someone who's found a solution and it's maybe changed outcomes for them?
Sure, absolutely. So I'll give an example from one of the communities we're working in Detroit. And one of the major priorities that we're trying to address together is maternal and infant health. And how do we reduce the disparities? And one of the things that in our mobility leadership circle, some of the social workers and some of the participants who are mothers said, you know, the Medicaid transportation will help me get to my doctor appointment. The Medicaid transportation may help me get to certain therapy, but it will not help me get to Lamaze class. I cannot also get to classes for visits with a lactation consultant to support breastfeeding, so on and so forth. So these were gaps that were expressed. And then when we further started talking to some of the participants, they said, well, can I use this service to go get groceries? And let me tell you why. Because I cannot drink the water that comes out of the faucet where I can afford to buy a home. And when I cannot drink the water in my own home, do you think I can use that to make a baby bottle, right? And I live 7 miles from the closest grocery store. Am I going to, 3 days postpartum, take my little stroller and my infant in cold weather, it gets cold in Michigan in the winter, 6 degrees outside, for a 7-mile jaunt to go get water, right? That's a real story. And so what we did is we're deploying a mobility wallet where the mother receives a certain dollar amount per month, and if she decides to use an Uber or a volunteer driver or a taxi or a wheelchair accessible option, she decides, and if she uses that to go to Lamaze, she uses that to get groceries, that's her prerogative, and she has the autonomy to make the decision on how to use that transportation to support her and her baby's health. And so that's a very common problem in communities where there is huge disparities in infant mortality and health.
Well, thanks for making that connection between transportation and what's possible, and also getting to better health equity outcomes when you have choice. Giving people choice is something that you've held up, and each of you have also centered your work on the community as expert. So I'd love to have you comment on what this role is that community engagement and partnership can play when you're co-designing solutions, because you've outlined that there's pretty big disparities, right, in what's available now, and we know that there's a diverse range of need in terms of who's underserved by transportation today. So any partnerships or examples of engaging in the community that you would hold up? Valerie, is there anything you'd like to add?
I mean, I think for us, one of the other key areas is veterans, and there's so many challenges that veterans in urban or rural areas face. And I think this co-development of understanding where veterans are at and the unique challenges that they face, just really helps us understand and inform. For example, in some cases, there literally was not a transportation option that went from one county to another. And so that's why, this future of autonomous vehicles, you can program a robot. I mean, granted, I know there's mapping and all of the things, but if we can go to the moon with the technology of a toaster, I believe we can get there, right? And in rural communities, there's been autonomous technology for a decade. I grew up on a rural farm and 96 people in my hometown, and they had drones and autonomous pivots before I was out of college. So I know rural communities, especially when it comes to how do we break down these barriers, it's mobility wallets, but you still have to have the literal wheels to get folks from A to B. And the ability to use technology like autonomous vehicles, I think has a lot of promise in rural areas.
I'm glad you brought up technology. I'd love to continue on this topic. I know you all have experience in leveraging technology in a way that's really driving outcomes and scale in solutions. But I also know there's still a lot of gaps. So what would you share, Dr. Shelley, from your perspective? How can technology play a role in helping to address these issues?
So technology has a significant role to play when you think about this way. So I have a public health background, and so it's really important. As you mentioned, the social determinants of health, my soul just lit up. And so EVs, obviously, AVs have the opportunity to reduce transportation emissions and reduce exposure to transportation emissions, toxic chemicals. It also serves the opportunity to provide transportation in areas where there's transportation deserts, limited transportation and mobility access. So there's a lot of ways that this technology can help. It can take people to the doctors, to work, bring them food in areas where there are food deserts. So I don't want to sit here and act like AVs and EVs are the panacea, or that there's no issues with the technology, but with any new technology, there's things that you're going to have to work out. But I believe that engaging and utilizing EVs and AVs really can bridge the gap in what we're seeing in some of the mobility disparities.
That's helpful, and I loved hearing from Valerie about their mobility wallet as an option where an EV or an AV may be a part of many of the options that individuals can choose, and choice is so important. So I think we would love to close with the future. Looking ahead, what do you see as the future in terms of what do we need to innovate on? What are future opportunities? And how do we keep the communities you've mentioned, at the center of this process of shaping the future of mobility? Michele?
Sure, yeah, well, I envision a future where people who, like me, who use wheelchairs, can go places without any kind of friction. Like I don't want to have to travel with anxiety. Every time I want to go anywhere, I'm always wondering, am I going to get there on time? Am I going to get there at all? What is the way that I will do that? And is it the bus? Is it the train? Is it a combination of rideshare, taxi, airplane, bus, all the things? And so every step of the way, there are accessibility barriers. And I have experienced them, the gamut of them all. And so just to live my life without any kind of anxiety or fear, and just to be able to go where I want to go is a dream for me. And I do see where technology can play a large role in that, but also in partnerships, because we can't do that together. At the CTA, the Chicago Transit Authority, can't just magic wand and add another train station or add another bus line. That costs a lot of money, and we welcome the opportunity to partner with other organizations to find ways where we can really provide access to more people in more innovative ways. And maybe that's through autonomous vehicles, maybe it's through mobility wallets. I love all these ideas, and I think that the future is accessible if we all work together to make it that way, because it's not going to happen if we don't do it together.
Absolutely. I think from my perspective, it really is about changing the policy and how we support transportation and equity in this country. The way there's 130 federal programs that fund transportation. In order to access those programs, there's a different form that you have to fill out with each one. And we believe that the mobility wallet enables individuals to decide whether they want to use the bus or they want to use another resource. That's their decision, and that reduces the friction, but also the control and autonomy that mobility leads to with health equity.
And I guess I will conclude with adding in that it's so critical to engage with those communities that are bearing the undue burden of mobility disparities. And so what that means is compensating them for their time. When you want their time and their expertise, compensate people just like we want to be compensated, and all of you here are being compensated for being at the conference, even you're working. Compensate people, make sure that their voice is helping to co-create both at the beginning phase of the work, during the implementation phase, and then during the evaluation, so that we can refine those strategies to make sure that our solutions are co-created by the community. They're their solutions to address their needs, because they know that what their needs are the best.
Well said. And this is such a wonderful reminder that transportation is actually plays such a key role in how we build resilient, inclusive communities that we all want to be a part of. And I took away, pay people who are informing your strategy. If you sit at a corporate social responsibility or foundation role, pay for their transportation, pay them for their time, and also co-create with communities. Make sure the voice of those who can most benefit and are proximate to the solution are at the center of your work, and that's how we're going to get to this more accessible and inclusive and equitable future that we all want to be a part of. So please join me in thanking Drs. Shelley, Valerie, and Michele for their amazing leadership and conversation today, but what you do every day is pretty incredible.